Please subscribe and tap the bell icon.
Maharishi Sushruta, the father of surgery and father of plastic surgery, was one of the earliest surgeons 6,200 years ago, and is the first individual to describe plastic surgery. The Mahabharata represents him as a son of Vishwamitra. Sushruta, who lived nearly 150 years before Hippocrates, vividly described the basic principles of plastic surgery in his famous ancient treatise, Sushruta Samhitha. Sushruta Samhitha, or Sushruta's Compendium, which is one of the oldest treatises dealing with surgery in the world, indicates that he was probably the first surgeon to perform plastic surgical operations. Although many people consider plastic surgery as a relatively new specialty, the origin of the plastic surgery had his roots more than 4,000 years old in India, back to the Indus River civilization. The religious shlokas associated with this civilization were compiled in Sanskrit language between 3000 and 1000 BC in the form of Vedas, the oldest sacred books of the Hindu religion. This era is referred to as the Vedic period, 5000 years BC, in Indian history, during which the four Vedas were compiled. All the four Vedas are in the form of shlokas, verses, incantations and rites in Sanskrit language. Sushruta Samhita is believed to be a part of Atharva Veda. The Sushruta Samhita devotes chapter after chapter to surgical techniques, listing over 300 surgical procedures and 120 surgical instruments, in addition to the 1120 diseases, injuries, conditions, and their treatments, and over 700 medicinal herbs and their application, taste, and efficacy, which are also dealt with in depth. Surgery was not considered a last resort by Sushruta, but actually the best means of reducing suffering under certain conditions. In a number of chapters throughout the book, a condition is described and a treatment suggested, which includes details on how a physician should perform a certain surgery from start to finish. These details, in fact, are what marks the Sushruta Samhita as distinct from the earlier Charaka Samhita. Charaka established medical knowledge and practice, while Sushruta developed surgical techniques and thus founded the practice known as Salyatantra, or surgical science. These techniques were brought to bear on a variety of conditions ranging from plastic surgery, reconstruction of the nose and cheek, to hernia surgery, caesarean section birth, removal of the prostate, tooth extraction, cataract removal, treatment of wounds, internal bleeding, and many others. He further diagnosed and defined diseases of the eyes and ears, prescribed eye and ear drops, established the school of embryology, developed prosthetic limbs, and advanced knowledge of the human body through dissection and the resultant understanding of human anatomy. His knowledge of how the body worked enabled him to heal without resorting to the supernatural explanation for disease or the use of charms or amulets in healing, but this is not to say that he discounted the power of a belief in higher powers. His commentaries throughout the book make clear that a physician should be aware of and make use of every facet of the human condition in order to treat a patient and maintain optimal health.